Thanks everyone for joining us. Welcome to Essential Considerations for Childcare Providers. This is workshop 2 or webinar 2 in our 4-part series that started last week, Wednesday, and will run through the last Wednesday of this month. With us on the call is Yasmin Maddox. Yasmin is the founder and CEO of Architect, and Yasmin is the presenter of this series. I'd like to welcome Yasmin. Welcome, Yasmin.
Hi, thank you.
And before we get started, we just want to say a great big thanks to our sponsor, 5 Star Bank, for sponsoring this series, for their ongoing support of Paso and Enterprise Center and the individuals, small business owners, and communities that we serve. So without any further ado, we're going to get started. Yasmin will pause from time to time and take questions. Feel free to take yourselves off mute and ask your questions. Otherwise, you can type your question in the chat and we'll read those out and get to them. So Yasmin, take it away.
Hi, everyone. It's great to be with you all again for this second of 4 webinars in the series. Today, we're going to be focusing on a topic or subject matter that is exceedingly important, perhaps more important now than previously, but one that can admittedly be a bit dry. So like last week, I'm going to do my best to pep it up a bit. Without further ado, the focus of this webinar is really on de-risking your operations, both in the context of preparing for a COVID-19 world and all that entails, but also in terms of shoring up your resources and shoring up the knowledge and data you have at your disposal to de-risk your operations in a general sense. Whether we are fortunate to get a vaccine for COVID or not, there are certain pillars or foundations upon which your business as a childcare provider should stand. And so we'll be going over that with what I'd call a layered approach. And of course, this series and obviously included in that, this webinar is brought to you by Pastone, 5 Star Bank, and Architect. So the agenda for today is broken up into 4 sections. Assessment of current operations, so what you are currently doing. Planning public health conscious operations, so maybe not necessarily what you're doing now, but what you should not only aspire to do, but what you should actually implement. Mitigating risk factors that exist for your business as a childcare provider and just in the general sense. And then finally, bolstering preventative measures. So all of these are meant to provide a holistic or a comprehensive approach to de-risking your operations, and it will ultimately feed into or lead into the content for next week's webinar, which is more on differentiating your strengths, your positives as a childcare provider and as your business as you go and seek to market more to get prospective families to become current clients. So section 1, assessing your current operations. The most important part of assessing your current operations really lies in your ability to be honest with yourself. Not so much to be honest with others, which you certainly need to do, but first and foremost, it is your business. And it's in many ways your baby, I would suspect many of you at least would say. And so you want your assessment to be rooted in honesty, and the best way to get there is to really go through questionnaires that have already been done, as well as those that you can put together for yourself, and checklists to see where you fall in terms of how you are currently running things. So process is everything. The steps that you take to understand where you currently are and the steps that you take to get to a better place are interrelated. There is most definitely a start and end point. With that, the only caveat I would provide is that you are continuously learning about how to improve your business, but in terms of, you know, the process you take for de-risking your operations, you can think of that as something that you do ideally want to do on a regular basis. Regular may be monthly, it may be quarterly, it may be annually. You have to figure out what is the best scenario for your business, including how much business you have and how much time you have to commit to this. So first, you really want to dig into your legal and insurance matters. Then you want to dig into the perceptions and questions, considerations, et cetera, related to your clients, to the families you serve. Then you want to understand what your operations look like with respect to the people who make it run, your personnel, your staff, your employees, contractors, if you have contractors. And then, of course, you want to do an assessment of your facility. So we are going to dig into the finer points on that. So legal and insurance. That's the header here. First, we're going to look at medical and medical related considerations. Because of course, in the middle of a public health crisis and pandemic, the most pressing concerns oftentimes, and you know, principally, or at least in the beginning, are the medical issues, the medical questions. So the first thing that you want to understand are, what do applicable laws have to say about your ability to do temperature and symptom checks and disclosure of medical conditions? Now, I'm starting with that because that's going to be the first thing that a lot of people think of when they go to your childcare facility, whether it's in-home or whether it's center-based. The first thing that is going to come into people's minds, whether that's a parent, a family member, whomever, a state or, you know, municipal inspector, whomever it may be, they're going to want to know, well, what is the state of health of the people in this facility? Now, of course, you want to be prepared to understand who is in your facility, including personnel, including children, including yourself, but you have to know how to do it in the appropriate way, in the way that will at once help you de-risk your operations in terms of minimizing the risk of COVID transmission, but you also want to do so in a way that is cognizant of the law. Laws that come into play are ADA and GDPR. For those of us, you know, in the States, ADA, Americans with Disabilities Act is what, 30 years old now. So that shouldn't come as a surprise. However, GDPR, which comes from the European Union, is relevant only insofar as the guidelines they have for understanding the type of information you collect really is a benchmark that lots of agencies and organizations in the US and in New York use. So best practices, so to speak. So you want to understand what laws have to, you know, what does the law have to say about your ability to do temperature and symptom checks and disclosure of medical conditions, which we are going to get into. If you are collecting health information and data, do you know your responsibilities regarding ADA? So a lot of this will be interactive in the sense that I am going to go to a number of sites to really show you where this information exists, how to use it, both proactively and if needed, hopefully it doesn't, but defensively in terms of anybody, you know, calls you out on anything or says, you know, well, do you have this? Do you have that? You can say, yes, I have this information. I know how to use this information. So on this website, which of course you will have access to when you get the copy of this presentation, this goes over all of the information that you should know about COVID-19 as it concerns the ADA. Of course, this will come more into play when we go over the personnel part, but you want to know this before anything else happens. So many people are in a rush to say, okay, well, my facility, my business, et cetera, is safe because I am checking temperatures. But a lot of people are also making the mistake of just bombarding employees with questions about their health, much of which is, you know, a matter of consulting the ADA to see what you can and cannot do, as medical information is by nature private. So I'm obviously not going to go through this writing in its entirety, but this is here for you to review at your own leisure. There are frequently asked questions that are laid out here. This particular page and website has the weight of attorneys. So this is not just general information. This is provided by the U.S. Equal Employment Opportunity Commission, and it's overseen, for instance, by attorneys who make sure that all the information is relevant and it is accurate. The GDPR I won't go into, but again, you have access to that. So are you providing advance notice to employees, visitors, et cetera, of what you'll be requiring of them to be on premise? So what you oftentimes lately have been advised to do is to put something up on the premises. The issue here is that, of course, not everybody speaks the same language, so you want to make sure that you are inclusive with regard to language, but you also want to make sure that you are really, really specific and you are really relatable. And by relatable, I just mean you want graphics that will capture people's attention. The CDC provides resources for different photo assets, different animations that you can use on your web page, on your Facebook profile, or business page, what have you, but that you can also print out. With it, you have the benefit of not only having people wonder, well, where are you getting this information? People can see that it's from the CDC. And there are also supplementary agency photo assets that you can use. But the messaging should be clear, particularly if you're working in environments where there are individuals from varying backgrounds who speak different languages. In Rochester, New York, that is one of the wonderful things of our community. There's a lot of people from different backgrounds, but there are people who may not understand. And so these graphics come into play because they are incredibly important for people who have language barrier issues. And of course, how are you keeping any collected data safe? So I had mentioned last webinar that as of September of last year, there had been some changes to what childcare providers, among other people, had to do to keep information safe, especially in the event of any data breaches. You want to make sure that this information, all of which is likely new, that you will be collecting in some form or other, is being kept safe, that you have a protected digital file for it, that you have somebody in mind and actually activated, so to speak, to take care of that information, so that if there are any breaches that meet the criteria to notify the state, you do so, and you do so quickly. Policy considerations. So you want to familiarize yourself with policy or policies and the particulars that you have, including property and business interruption. Something that's come up, which I'll say has been quite heartbreaking, is that it's one thing to not have insurance. And there are several reasons why people don't have insurance, that come down to perhaps lack of assistance in understanding what plan would be best, if being honest, lack of funds to pay for insurance, even though each childcare business should have it. But also, the biggest heartbreak perhaps is having insurance policies that don't cover your needs. So what we're seeing a lot of are childcare providers who are finding that they don't have policies that actually help them in this case. Policies that speak to business interruption issues, so that, in particular with regard to the pandemic, you can get the cost to clean up contaminated areas covered. So if you've had an outbreak, for instance, which I'm assuming most of you have not had, but to use the example of nursing homes, do you have the funds liquid available to actually do those cleanups? Do you have enough funds to carry you through this based on loss of revenue, which is much more relevant to childcare providers. As a note, when I was preparing for this, something that came up, which was quite striking to me, because it didn't seem very logical on the one hand, but when I read further, it made sense. A lot of childcare providers are finding, especially those who provide in-home, group family care, that when a lot of the center-based programs or facilities shut down, even if only temporarily, they expected to get an influx of new clients, of new families, of new children to care for. But that did not happen. And that did not primarily happen because parents were concerned that the businesses did not already have certain things in place. And so instead of seeing that, what you would think to be that natural uptick in demand, there was actually a dramatic decrease in demand, which further exacerbated the fact that many were not getting the revenue that they were used to getting. So you really want to look at, policy considerations in terms of what your policy covers and does not cover. I want to draw your attention to Insurance Journal, which may not seem as exciting as other journals or other publications, but it's incredibly important right now. And I would implore you to just take 5 or 10 minutes out of your day, if not today, then sometime certainly before the end of the week, to see the various articles, the various, pieces on what's going on. Because the biggest help to you, not necessarily right now, but going forward, as we start to anticipate an uptick in COVID cases as the fall comes around, will be the need to understand if you are entirely locked out of getting some type of pandemic insurance, or if you can still get in, but perhaps admittedly at an increased premium. So you want to look into these issues. A lot of people, as I mentioned, are finding out that your standard policy does not cover what happens in a pandemic. And so you really want to see, okay, well, what policies are available to me? This article, which I would encourage you to read, is very quick, maybe about a minute or 2 minute read, and it goes over a couple of products that you can look into as childcare providers. So more policy considerations. You want to be aware of any exclusions relating to communicable diseases. Many policies have that. You want to seek out additional coverage if needed again before the fall. And you want to document specific COVID-19 processes. So I know, of course, that the state, and I realize that there are people here who are outside of New York State too, but speaking to whatever state or jurisdiction you are in, there are already processes and guidelines in place to help you. You want to build upon that. You want to layer upon that so that you have, a skeleton of what to work with. But then given the particulars of your program, your facility, you actually have a process in place of how to document, COVID cases. Now, what gets interesting, if not a bit difficult to achieve, is the fact that, again, going back to ADA and medical information, which you can read about in that link I provided, you can't really disclose to people who has COVID or who has anything for that matter. All you can do, the best you can do, the most reasonable thing you can do, is to advise people that they may have been exposed. And that is something that has come from all of the legal eagles, so to speak, that has come from SHRM, which is the most probably, I shouldn't say most reputable, but national organization for HR professionals. You just want to be careful that you have those processes in place, that those processes include processes for communicating threat or exposure potential as it applies to your business. Ultimately, you want this just as a matter of good record keeping. Hopefully, you do not have a great many cases of COVID, if any. But as we have come to learn, this virus is quite easily spread. And so, you want to prepare for the worst, hope for the best. You will certainly want to have these processes in place. And I would say actually documented actually on paper or, on a Google Drive or Dropbox, wherever, so that if the time comes where you need to file a claim, you can do so effectively and efficiently. So assessing your current operations in terms of your clients and their families and really what they're thinking. Last webinar, I had brought up a couple of quotes that I read about considerations and concerns that some parents have, and I'm going to add on to that. So you can really start to break down what this means for you and your business and your operation. So of course, the first concern is whether adults will consistently wear masks, take time off if feeling sick, and limit unnecessary contact with each other and children. So it's not enough to, just assume that parents know this. The advice being given, not just through me, but through experts in the field, are saying, look, whatever you think parents are thinking, and we have proof that this is what they're thinking because these are quotes from real parents locally and afar. You want to anticipate those concerns. Certainly when you get word of actual concerns in writing or whatnot, and if you don't already have a suggestion or a comment box, and that could be, 20th century, literally like a shoebox with a slit in it, or it could be a Google form survey so that people, parents can send you their concerns and their suggestions. You want to create an FAQ page on either your Facebook, your social media page, or your website that gets at the heart of these concerns, that anticipates them, and then that quickly, as best and as reasonably as you can, shuts them down. So, of course, whether adults will consistently wear masks. That concern is something that can be quite easily not refuted, but quite easily shown to be minimized. If you say, okay, we understand that seeing our staff, seeing our personnel wear masks as they are strongly encouraged to do, if not required to do, is important to you. Therefore, why don't you use something to see that it's actually happening? So for most of you, or for at least some of you who have, cameras, monitors in your facilities for parents to check in, you could say, parents, put your minds at ease, recall or remember that you have the ability to check in on your child, check in on us throughout the day, and you can see that we are consistently wearing masks. So things that you can do to not only, say in writing, but to actually corroborate visually, that you are addressing the concern at hand. But taking time off for feeling sick is something that I'm going to get into, I think, in another slide or two. But to quickly address that, this obviously is an incredibly pressing and major concern, not only for parents, but I think for all people who work, and all people who associate themselves with people who work with others and who don't work remotely. Many people routinely still are struggling with, okay, well, if I'm sick, is this likely COVID sickness? Do I have allergies? Do I have a common cold? At the beginning of all of this, it was still, do I have the flu? Because that was a real possibility. So the way that you are advised to address that, as I mentioned last week, is with honesty, by being forthright, but also having a process in place, a checklist, if you will, of what specifically would preclude somebody from coming into the facility, coming onto the premises, and making that abundantly clear. Something that's been discussed at length over the last couple of weeks in this space has been, well, if people come in sick, what penalties are there, or what penalties can you make? One parent in particular asked that be thrown out during this webinar, that be conveyed. And to that, I would say, the people that you work with and the families that you care for the best. But you do likely want to find ways that don't put people on the defensive, that don't make people more incentivized to withhold information than to provide it. The limiting unnecessary contact with each other and children, admittedly, is tough, right? Because the name of the game is childcare, and you and your employees are providing childcare, which by nature, involves that you are supervising children in very tight quarters if you're doing it, in a way that actually looks out for their well-being. So these are things that you want to, just be aware of. And again, an FAQ that addresses these concerns is appropriate. One parent noted that her child, or their child rather, I don't know if it was a mother or father, is adapting back into a routine that doesn't include that parent. So they want to make sure that their childcare provider provides support with that in mind. So the whole idea of not only is it a change of routine, but there may also be some effects on socialization, on how the child is feeling not only being away from their parent, but having to do new things in terms of new safety and health and well-being procedures. So that's something to consider. Consistent cleanliness is not a new concern, but it came up about, I think, 27 times. It was a consistent concern. So cleanliness can mean a couple of things, right? Cleanliness can mean that you have a tidy facility, that things are where they need to be. You don't have a bunch of clutter. You don't have things sprawled out or strewn all over the place. But you want to make sure, and this is speaking, at least in part to next week, you want to make sure that all of the terms that are being thrown at you by parents, all of these questions and concerns are understood in the way that they're meant. And if you are unable to do that, especially if you get anonymous feedback, you could also always assume the worst case scenario. So instead of thinking that parents are just, worried about superficial cleanliness, and not only if things are tidied up or if wash rags have been used on surface areas, etc., but think about, okay, well, what levels of cleanliness exist in the facility? Are we talking just high level of countertop surface areas? Are we talking nooks and crannies where our children that we care for like to get into, that typically we would keep clean, but we wouldn't be really hyper vigilant about it? Think about those things. And of course that will, vary based on your particular facility, because each one is unique. But think about what cleanliness actually means for your facility, and how you can devise cleaning checklists that actually meet a fairly rigorous standard. That may be the difference of perhaps thinking of an initial clean, deep clean, as something akin to spring cleaning, but then you just keep up with it on a daily or weekly basis, making it a much smaller deal than it needs to be in terms of expending staff, energy, resources, etc. Having them closed again and being left with no childcare. So this one's tough, and admittedly, this one requires more work on a regular basis in terms of shoring up your resources, understanding your particular financial positioning and situation as a business, understanding what logistics are involved if you need to shut down again, which in some cases may be up to your own call, but in many other cases may likely be a matter of the government and what the government mandates in terms of any shutdowns that may occur in the future. Day-to-day procedures, checking in with me and my son's father, food tracking, location tracking, direct contact with others that have been sick, must be responsible and dedicated to that role. Consideration of COVID-19 vaccination, staying up to date with the news. So that's a lot, admittedly. But the gist of it is really a process. Having a process. This parent in particular wants to know, okay, what procedures do you have in place for X, Y, and Z? How are you tracking food? And related to tracking food, how are you tracking, even more so than before, that nobody is sharing food, which is already not a new standard, if nothing else because of allergy reasons, But certainly now, what additional, if needed, precautions are you taking? And not only what precautions are you taking, but what precautions and lessons are you bringing the children in your care into so that they understand and so that they incrementally can be more proactive and self-sufficient with helping you lessen the burden of ensuring that everybody is safe. Because depending on how old the children that you are caring for are, they can do things. Kids, obviously, they need the supervision of adults, but you want to do things that are age appropriate to them. So whereas a 2-year-old or a 1-year-old certainly cannot do a great many things, they can understand in an age appropriate way to cover their mouths, things like that. So with this particular comment, you don't necessarily need to think up or innovate whole new ways of doing things. It's actually recommended that you go back to the basics and say, okay, well, with all of this change going on, what do I know to be true? What have I been practicing in the past that perhaps I became a bit slack on because, nothing of this magnitude has happened. Go back to those considerations. Whether my child will contract the disease and what the long-term effects of the disease are. Okay, so that one is something that admittedly you probably can't do on your own because you don't want to get into the debacle of providing medical advice. What you can, however, do is go to websites such as the CDC, or more close to home, go to websites of local pediatricians, local hospitals, healthcare systems, etc., within your area, and go to the pages that specifically deal with these issues, such as what are the long-term effects that we know of that we are trying to figure out, etc. You can point parents towards resources regarding studies that are currently being conducted, studies that are recruiting individuals to be conducted, just so they have a better sense of what information there is, and also so that you can position yourself really as a subject matter expert. Because the idea here is that, of course, you're not going to know everything, but you have a critically important role. And the more information that you take on for your own benefit, for your own professional development purposes, the more information you can transmit to your client families. And that in turn creates not only better rapport, but it positions you as an expert, a subject matter expert that they can turn to first, because they already have that established relationship with you, and say, hey, I was wondering about this. Do you have information about this? And either you can provide it to them, or you can just remind them of where to find it, which is a much more efficient and perhaps effective route to take. This one particular parent says, contact with people that have COVID-19, stress, scheduling because of emergencies on her end, licensing and certifications. So again, this is a lot packed into, one sentence. But the one thing perhaps that stands out the most, and then the second thing, stress. Again, contact with people that have COVID is clearly important, but the stress factor is key. You want to provide information and ways of doing things that are readily expressed to current client families, as well as prospective client families, that you are there to limit, if possible, their stress, your own as well. But one of the ways that you do that is with information. Right now, the biggest thing that parents made known in actual interviews was that they just want information, and they want the people who are caring for their children and working with their children to have the same information or more that they have. Assessing your current operations regarding personnel. So personnel employee SWOT analysis. Now, I don't know how many of you have heard of SWOT analysis, and if you feel free to type into the chat, I have or I have not, that would be great just to get an idea. But long story short, SWOT analysis is something that's used in business as commonplace, and really it just means strengths, weaknesses, opportunities, and threats. Typically, this is used in the context of understanding the strengths, weaknesses, opportunities, and threats facing a business, which is something that an activity or an exercise you should engage in, but it's also something that you should do to understand your, thank you for, we had one individual comment, thank you. So it's also something that you should do to better understand not merely your business, but your employees, the people that you work with day in and day out. So at the high level, it's easy to say, okay, well, you know, Samantha, she's been with us for 10 years or however many years, and she's really nice, she's really kind, you know, the kids gravitate towards her, et cetera, et cetera, et cetera. But you really want to think more strategically about deploying your employees and yourself in ways that will better help the business, and better help the business not only to de-risk things so that you are not as put upon in terms of adverse consequences of future shutdowns or, you know, cases of COVID transmission within the facility, but also so that you have a better sense of bringing in more families, bringing in more revenue as a means of really bolstering the financial position and the longevity and the sustainability of the business. So you want to know, and you can do this a great many ways. I personally am not a fan of performance reviews because that conjures up many negative images for me. Not personally, but I think people just don't like the term performance reviews. But what is suggested is taking each of your staff members aside and just, you know, having a conversation and saying, hey, what do you think your strengths are? I would really like for us to work on better supporting the business, especially because it's a time of a lot of uncertainty. How can we better work together, incorporating your individual strengths, mine, and the rest of our teams to do what it takes to make ourselves more cushioned from any setbacks or fallbacks that the current pandemic may throw our way. So what are your strengths? What are your individual strengths? And people love speaking about themselves. This is something that market researchers know in great detail. And really your employees will feel not put upon, but rather perhaps flattered that you're thinking about this from a different approach. So really dig in and ask your employees what their strengths are. Now, SWOT, of course, does have the W in it, which stands for weaknesses. I am telling you as seriously as I can, do not bring up what are your employees, what is your individual weakness to an employee. Even though that's what the W in SWOT stands for, you can just refer to it as areas of improvement. And oftentimes areas of improvement really are hidden as areas that people have some interest in, but areas that they know that they would like to be better at or to do better at. So, frame it in a way which you can do best because you know your own people, but frame it in a way that's like, look, you already told me your strengths, which is great. What are areas that you would like to do better at, and how can I help you? And as far as how you can help your employees with this task, sometimes you can't directly help them, but you can refer them to resources that can help them. And in either case, it's a win-win. So what are your employees' strengths? What are their weaknesses, or more appropriately termed, areas of improvement? What opportunities can each individual employee help your business to realize? So many childcare businesses do not operate within silos. You operate within communities, which oftentimes are very well connected and interconnected. So if you have a particular employee who goes to a church that has a lot of active members, would that employee be willing to pass out flyers to the church leadership to say, hey, we know that a lot of parents are struggling with childcare. Is there anything that we can do? Can we help you? If there is somebody who has access to somebody who works at, a local radio station or TV, station, are there any relationships there that could be leveraged so that you can get more publicity, especially if you have a certain spin or angle on the services that you provide? Is it a feel-good story that you can provide, etc.? So you really want to activate, so to speak, your employees to understand that they can help you and help themselves do better by realizing opportunities that are really custom made to each of their strengths and their networks. the networks that they're a part of. What threats to your employees' ability to do their best work exist? So opportunities are great, but opportunities and realizing them don't get very far if you're not also taking stock of what threats exist. So one of the threats that I'll get into in a couple of slides, the biggest one perhaps, is the financial threat that has really put a lot of strain on childcare workers. I'm not telling you anything that you don't know, either if it's a matter of your personal story in terms of your business, or just you know it from being in the industry, in the space. You do not go into childcare because you imagine that you're going to be as wealthy as Jeff Bezos. You don't do that. You go into childcare because you really, really care about kids. And the finances, the economics of childcare are difficult. And especially over the last few weeks and a couple of months, they've been even more difficult. So for those of you who've had to, furlough employees, for those of you who have had to shut down entirely and you're now wading back into the water to reopen, of course, financial issues are going to be a great stressor and therefore a threat to your employees' ability to do their best work. So in what ways can you provide a safety net for them? Even if you can't directly provide a safety net, the next best thing, again, is information, resources, connections to those who can do that. So you still get the same net benefit or net effect. With this information, with this SWOT analysis for each of your employees, you want to review the information and put together a plan to activate those strengths and improve upon areas needing improvement, skill sets, etc. And you want to do this, hopefully, ideally, in the next week or week and a half, because the concluding webinar is actually an opportunity to speak with different individuals who would potentially be good fits to be advisors to you and your business pro bono. So then where can you fix inefficiencies, which likely cost you money? Ultimately, you want to get this information to do better, to move forward, to provide better services, to command, or at least to signal how valuable you and your services are, which in turn commands more revenue, but also to prevent you from losing any revenue in ways that you may not realize. You want to ensure that you have greater gains and fewer losses. So now, regarding your facility or facilities, if you have more than one, you want to consult safety checklists to refresh your memory and to layer preventative measures, as mentioned before. So New York State has checklists on their site, which was provided in last week's webinar materials. This one I like. It's from Gerber Life Insurance Company for a couple of reasons. One, I'll just be real with you, it's pleasing to the eye. It's not a lot of words just built upon or jumbled upon each other. It's pretty nicely spaced out. So it's easy on the eyes. It's broken down into locations of your facility. And also because, and perhaps more importantly, insurance companies, bar none perhaps, even though there's lots of tension, of course, with insurance companies in some regards, with payouts of policies, insurance companies oftentimes are the leaders in terms of risk management analysis. And obviously they do that for very clear business reasons. But I would strongly encourage you, whenever you're wondering, oh, well, is there a better way that I could potentially be doing this? Is there a way to de-risk my operations? Look for writings, look for checklists, et cetera, provided by insurance companies. Because behind all of the computer algorithms that now take place, ultimately it starts with a laying out or a checklist of issues that need consideration, which you can yourself check off, go line item by line item, check off, bring other people in. Something that I had mentioned last week, which I'll reiterate right now, is at a minimum, you want to do this as the owner, director, et cetera, of your facility, of your business. But you also want the insights and the perspectives of those who you hold close among your staff. So you want to have your own checklist, but then you also want to say, hey, Sam, or hey, John, or whomever it may be, would you look at this checklist and see, one, if we meet all of these criteria, and two, if there are any things that maybe this checklist left off that's directly relevant to our facility and our case. So you can really take an observationist approach from other people to add to the knowledge you have about how you're currently operating, how you're currently running your business, and how you can improve. So looking at this, I'll give an example. So paint is peeling. No, we won't go there. Electrical outlets are covered. That's standard. Windows have high window guards, yet can be easily accessed. Not so much there. I would say look at, for instance, on this checklist, exterior doors are secured so that children can't wander outside. Now, in the best of times, we have children who are wanderers, right? And so this is pertinent for any particular time. And I will, with love, say that my middle child is the type of child that, this type of criterion is probably made for or made after, because she is a wanderer. That said, think of the overall context when you're doing this. Children have been cooped up for months. They're itching to get out. They're itching for playtime. So situational awareness comes into play here too. So when you look at this checklist, I would encourage you not just to look at it for the words that are actually here, but for your awareness of what's going on with children based on the current circumstances. So if kids are more likely to potentially try to wander now because they want fresh air, or they want to get out, or they want to do X, Y, and Z, what does that mean for how you have to shore up your resources and how you delegate staff to do X, Y, and Z? So I wanted to give you just one example of really how to go through this checklist and others to really take a layered approach to say, okay, well, this is the bare minimum. These are the bare bones. What else information can I provide given my facility's unique particulars? And how can I build on that information to put into place processes that are going to really make us a safer place, both in terms of actual, COVID-19 related precautions and just general precautions as well. So planning public health conscious operations is this next section. So what does it mean to have a public health conscious operation? I've really done an amalgamation of definitions here, but ultimately I've said it's to have operations where you intentionally consider the data and knowledge available to you to help ensure that your operations protect the public health by protecting the well-being of those in your care and under your employ. So two groups, right? The children who are in your care and your personnel, your staff, your employees. Much has been said, especially as of late, that many children, if they do come down, if they do get coronavirus, which leads to the COVID-19 disease, it's oftentimes mild to moderate in terms of symptoms. There are admittedly cases, I think in New York State, it's still hovering around 100 cases of severe complications, quite serious complications as a result of COVID. But ultimately, researchers, scientists are finding out that kids, being resilient in all other aspects of life, are particularly hardy when it comes to this virus. And yet there's still this great public health concern and considerations that follow, because kids, are, to use the term, vectors, so they can transmit to other people who may be high or moderate risk to not only get sick, but to get severely ill through complications. And so you want to consider what data and knowledge you have available to you to better protect their well-being in terms of any activities you do, any processes you have in place, and then how you do that with regard to the people within your employ, your staff, your personnel. So here we have a Venn diagram with the three core types of health that are relevant right now. Physical health, which of course has been the dominant consideration, but it's not the sole one. Mental health, which is directly related to both physical and social health, and then social health. So social health is very, very important to parents. If you ask most parents why they even put their child or children into childcare programs specific to the ones that they choose, they say, well, I work and so I need childcare, but also I want my child to be exposed to other kids so that they learn how to socialize. So socialization and social health is critically important. In terms of the three intersecting types of health, you want to be aware of how public health considerations, of how guidelines from the CDC impact children in your care. So you can go to the CDC website for guidance on this. But the guidance that's provided here is really procedural guidance rather than a more holistic approach as to, okay, well, we understand to some extent that kids are likely going through it, so to speak, right? They're having some measure of difficulties in terms of really adjusting to these changes. There was an article, and I will provide it in the materials that came out yesterday, about how a number of universities are just now getting the methodologies together to do long-term studies about the mental health and social health repercussions of COVID and of sheltering in place on kids' development. So these issues are front of center, in front of mind for parents, and they should be for you too. So these three types of health considerations interact. These considerations also are relevant for your employees. So as I mentioned before, you want to know regarding mental health, what stressors are your employees experiencing? And regarding physical health, are the lines of communication open with your employees? So in both cases, and hopefully this does not come off as too blunt, as a business owner, you always have the power to, and obviously contracts come into play here too, which is, an aside. You'd have to look at your agreement or your contract, but you don't have to have anybody necessarily as a customer. You can, within legal limits, you can choose, which is to say, going back to the issue of, okay, well, what if somebody isn't honest about the fact that they're sick and they're going to come into the facility sick, and what penalties are there? Penalties are something that you want to think creatively and about. You want to really frame it as incentives to be honest, incentives to only come in if people, whether a child or an employee, is healthy. But you want to ultimately understand how to achieve that. So you want to keep open lines of communication open. So a nod back to anonymous communication, etc. But you want to really be able to understand, okay, what stressors your employees experiencing, and are the lines of communication open so that they will tell you if they are physically okay, as well as mentally okay, because stress can manifest in a number of ways that aren't conducive to working with children. In terms of the primary physical health related guidelines, which I'll go to in a moment, I just listed five particular spots to pay attention to in a sea of I think I lost count when I was last counting them the day before yesterday. But of course, the guidelines are right here, so you can actually look at the actual statutory executive order language. So physical distancing, much has been said about, staying away from people 6 feet or more if possible. Obviously, and various executive orders, depending on what state you're in, have said, look, you've got to work with what you've got. So depending on the size of your facility, the size of the space that you're working in, if it's not physically possible, you have to do what is possible and what is, most importantly, as the law and as government statutes and everything stated or emphasized, what's reasonable. So that includes a great number of things, but principally, you want to just emphasize among not only employees, but children, spatial awareness. So even if you can't have a yardstick or a rule or whatnot and actually know what 6 feet is, even with, you know, tape on the floors or circles, etc. Because again, kids are kids, and you have to have a certain amount of maturity, not only to see that, but to also abide by it. You want to work on really getting the kids in your care and helping and having the personnel who work with you help them to just better understand spatial awareness, so that even if there, you know, is an occasion where somebody is not, you know, maintaining that space, how to communicate boundaries, how to communicate, okay, well, you know, there needs to be more space here, etc. So as important as these actual guidelines is how, again, as mentioned last week, you work within them in a way that is custom made for your particular situation. So static group size, much has been discussed about really trying to have consistency in who you care for. So there's not a lot of, you know, new people coming in, leaving, coming in, et cetera, et cetera. Now, of course, that applies to certain groups, and it doesn't apply to others, which again are more more explained in the guidelines. But roughly, at least in New York State, it's 10 children or campers or fewer, right? So you want to maintain those numbers of groupings for the consideration of reducing as much as reasonably possible the spread, the transmission of COVID. For face coverings and physical barriers, as we know, people can wear medical grade or non-medical grade. So a cloth face covering or mask. You could also erect physical barriers to help with physical distancing efforts, but also mainly to help with decreasing transmission. So you know, airflow with plastic sheets or dividers. If used, you know, you must comply with OSHA guidelines and regulations. You would also want to look at the least expensive way of actually procuring those supplies, which I have resources that I will share through the email that will go out. In terms of dedicated child drop-off and pickup spaces and procedures, before I get to the example, I will say there was a commercial, an ad actually, on Facebook that I saw maybe about a week and a half ago, which was of a child care, a daycare center that was showing really as a means of marketing how they do check-in, you know, their check-in procedure in light of COVID. And so on the one hand, you want to, you know, have these procedures in place, but you don't just want to follow these procedures blindly without thinking of, you know, what else needs to be taken care of. So for instance, with this particular ad, the ad was about maybe a minute long, but a family with their, a parent, one particular parent with her son went into the facility, checked in, and the director of the facility was talking about how, you know, how much that they've really gotten up to speed with the, you know, the regulations, the guidelines, et cetera, and how, you know, she was using gloves to, you know, to make sure her hands were clean. But the whole time that she was going through this demonstration of their process and procedure for checking in, she had the same disposable gloves where she was touching a pen, she had touched her face, she had touched, I think I counted at least 10 or 11 other things. And so I say that to say, it's not enough to just have dedicated child drop-off and pickup spaces and procedures. You really have to internalize what that means down to the granular level, down to mask wearing, down to gloves, which is why it's advised not to wear disposable gloves unless you're a medical professional, because when people wear gloves, oftentimes it actually, you know, makes them think that they don't need to do the other things that they do need to do, like not touching their face, etc. So example that's given by the guidelines is parents and guardians are not permitted to spend an excessive amount of time in the child care or day camp facility. So again, that's in clear English. It doesn't get any clearer than that, except for the fact that what's an excessive amount of time? Is it 1 minute? Is it 5 minutes? Is it 10 minutes? Certainly if you said an hour, I think most people would say, okay, that's excessive. But again, you want to think about these guidelines, especially the components or the elements that have gotten the most attention, oftentimes because they're the most important to state authorities. You want to understand what these guidelines mean for you and your particular facility. So if you haven't already, or if you don't have a sense of it, because again, time blends when you're working with children, I would encourage you to, for the next week or even the next 2 days, get your cell phone out, get your stopwatch out, whatever, to time how long it takes, families or, kids to check in when they get to your facility, and then average those times with however many kids or families it was, so that you can see, okay, based on this average, on average, it takes a minute and a half for, families to check in. It may take 2 or 3 minutes on average for families to pick up their kids, because, they're not just dropping off, they're picking up stuff. Maybe they need to grab, a lunchbox or whatever the case may be. And so you want to provide your own specificity and fill in the blanks. Again, that layered approach to layering information on top of information. The state or your licensing authority has given you the bare bones of information and guidance. You need to now fill that in with what you know to be true for your own particular facility. Soiling of children's clothes. So per the guidelines, children in childcare or day camp programs should have multiple changes of clothes on hand in the program facility or area. Responsible parties should make efforts to have spare change of clothes for children who either do not have extra clothes or have used their extra clothes as practicable. So, easier said than done, especially because I've spent part of the webinar talking about or acknowledging that many childcare providers, perhaps including some of you, are under enormous financial pressures. So having extra changes, of clothes may not be feasible as a line item for your business. But in that case, there are always workarounds. And what's become really popular over the last few weeks has been the increase in people in quote unquote buy nothing groups, which are found on Facebook. So buy nothing groups are groups that, as the name suggests, you don't buy anything, but really it's an exchange group. And so you are able to exchange with people different products, different goods. Most of the time it is, in fact, clothes, toys, etc. Now, consider that, but also consider that there's some things that you don't want to, get from people, right? So if somebody has brand new things that have not been opened, have not been used, I know in my particular case, I do not know what I was thinking when I had purchased a toy for my youngest, who is going on 3, but lo and behold, it was actually for like a 6-month-old. And so I literally have no purpose for it now. And that's something that could be donated. It's still wrapped. You want to pair the guidelines with what's already, what you already know to be reasonable. And if need be, ask local officials in public health. For instance, you can call the Monroe County Public Health Department if you're in Monroe County or whatever area you're in. Call the health department and say, look, I'm a child care provider. I know that the guidelines provided to me are to help prevent spread or COVID transmission by changing or offering additional extra clothes for kids in my care, especially infants or kids who are still drooling a lot. I don't have the funds for that. I'm a part of XYZ group where I have the ability to get new or secondhand but in good shape clothing. What suggestions or recommendations would you give to me? Would you tell me that if something is brand new, completely unused, I can get that from somebody free of cost? Or would you suggest, not engaging at all? So you want to use the resources at your disposal in all facets, from what you can procure and then figuring out how you can actually use it safely based on data that's readily available to you. And before I get into the answers to the questions from Dr. Elizer, you can always reach out to your local health department. When you call, you'll likely speak to, somebody who is not a nurse necessarily, but you could always reach out to them, and 9 times out of 10, if not 10 times out of 10, you can get the information that you need. Perhaps not, on your first call necessarily or within the first minute of the call, but they exist to protect the public health, and they are currently underutilized because so many people who focus on getting medical information and assistance from, private doctors forget that as taxpayers, we have at our disposal, at our use, public health department. So those are things to consider. Mental health considerations in greater depth for the care of children would be broken down like this. You want to provide materials that are readily available to parents who already have exceedingly little time to research a lot of the updated information regarding COVID, the information that they need to protect not only themselves, but you. So as a point of, I think, significant importance, mental health is really important for kids at this point in time. You want to provide these materials, one, because it's the right thing to do, because if you have information, hopefully you don't sit on it. And two, it's a differentiator in your ability to provide really top-notch customer service. I realize that when talking about childcare, it sometimes may feel weird to talk about customer service because it's not like going to a restaurant or going to the mall. But when I say customer service, I'm really just talking about customer or client relations, rapport, really creating a relationship rooted in trust, rooted in honesty and sharing of information. So you want to provide materials that are readily available to parents. And you may ask, well, yes, what materials are these? Among others, you should be providing the ability for parents to opt in to permitting you to provide information to the kids in your care. So some parents really don't like this idea. Others really love it. It depends on the relationship you have established with the parents and the families that you serve. So you can have a script of frequently asked questions, if you will, so to speak, that you can refer to, provide to parents that are your clients, that are your customers, to review and modify if needed, and then stick to. So to break that down further, if you have parents who have questions about a great many things regarding COVID, what you can do is you can start the ball, so to speak. You could start the engagement and write down frequently asked questions that parents have given to you. And then you could put down on paper the answers to those questions. And those answers can be based on your own experience to date, the experience of medical professionals, the experience of elected officials and their capacity to really articulate what governing agencies are seeking to do to prevent the spread, et cetera. But you provide that information, and then you give parents the opportunity to review it. And if they have the opportunity to review it, they can tell you very easily, okay, this is something that I would like you to say to my child if my child asks this question, or I do not want you to speak to my child about it at all. And whatever the answer is, you stick to it. But something, again, that has come up routinely is the whole communication issue. And if you are watching children for multiple hours of the day, questions come up. And so you want to know, rather than guess, whether you can actually have certain likely limited conversations with the children in your care based on what is age appropriate and based on what the parents that you serve are signed off on. Yes, so somebody just asked if I mean what we're allowed to share with kids, like age appropriate German info. Yes, that is exactly what I mean. I would also say that in terms of the mental health aspect, the whole reason of providing this information, the ability to answer questions, is not just because people just want answers to these questions, but also because there's a ton of research that shows that to help children's development and mental health ultimately, children need to feel a certain degree of empowerment, that they are being talked to, again, in an age-appropriate way, but in a way that tells them, you can learn, you could get information, you could use it. So that is something to be mindful of. So the FAQs are important. And again, everything that I'm telling you now is as touch-free as possible. And by touch-free, I literally mean you do not have to take pen to paper. You can do this really for free through Google Forms. And you know, articulate that information that way. Just give parents, just give clients your shareable link, and then they can have access to it. Consider incorporating activities that reimagine socialization skills. So I am not going to sugarcoat the fact that just as a result of what's going on, there are some things that cannot be done in the way that they were previously done. And instead of just saying, okay, well, you know, it's not that bad that, you know, you can't play in the way that you are accustomed to playing, because that invalidates kids' feelings. You can reimagine what socialization is or what it could be. You can innovate ways and activities for children that are aimed at reducing any of the negative, albeit unintentional, impacts of new guidelines. So kids love hugs. Kids love being all piled on top of each other, right? They love that affection. But obviously, that's not a real possibility because of guidelines, which are critically important to not only protecting their health, but protecting the health of their loved ones. So reimagine ways that kids can socialize. And I would say one of the best things about kids is that even though adults can be very imaginative in our own right, kids' imaginations run completely wild, as you know. So don't shy away from asking the kids in your care, what, you know, how would you do this? If you're used to, you know, hugging your best friend when you all check in for the day, but you can't do that right now, what would be the next best thing? Would it be an air high five? Would it be, you know, a certain word or a certain sentence or a certain dance that you do? Get their creative and imaginative juices flowing, because not only will it help in terms of the socialization component, which they need as a part of maintaining good mental health, but it also will serve as a coping skill and as a way of them learning coping skills, because honestly, we do not know how long this will last. Weekly emails to employees to check in and provide helpful resources. So I touched upon this before. MailChimp is great up until I think 2,000 people, and it's great after that. But by that I mean you can have a free account, you know, if you have fewer than 2,000 people on your mailing list, on your emailing list. I would strongly suggest thinking of sending out weekly emails to your employees that include free to low cost activities in your area, which you can crowdsource by using, you know, online publications like magazines. For instance, in the greater Rochester area, there's Rochester Kids Out and About, which provides a wealth of free and low cost activities. So if your employees have kids, but also are struggling with financial stressors, you could advise them of those types of opportunities. You could advise them of free and low cost opportunities or resources to find them that you know, involve museums, whatnot. Of course, you want to be mindful of not sending materials that could be misconstrued, that could be offensive, et cetera, et cetera. But if you look at a lot of companies, especially a lot of corporations, and even the biggest corporations that have you know, a lot of perks in terms of recreation, these types of emails are quite common and have been for a number of years. These weekly check-in emails provide information about these free to low cost activities, to be mindful of financial stressors that your employees are under. You could provide information regarding financial aid resources and tips to remind people that they exist. You could also provide EAP, so employee assistance program type assistance for public programs and private philanthropic programs and ventures. So again, the name of the game is information. people typically feel the most helpless, not just because they feel like they can't do anything to get out of their situation, but often because they don't have the information which likely exists to get them into a better position. So if you can facilitate that without monetary cost, but perhaps maybe an hour worth of time, that could be a huge thing for your employees to feel more supported, and in turn, they can be more supportive to you and your business. Mitigating risk factors. Health risks, safety risks, and personnel and operation risks. So health risks, especially because we are now in the summer season, though technically I know we're not, technically it's still spring, but I'm going to say the summer season, and it's getting quite hot in many places. You want to continue to do the things, practice the best practices that you would any other time of the year, certainly before COVID. So you want to look at the provision of water and food. Obviously, there are new guidelines that are attached to, how you serve, right? So instead of, perhaps most noteworthy is instead of having family style eating types of arrangements, you have staff serve children, if that's the type of situation you have, unless kids bring food in. But you want to be extra mindful that the children in your care are getting the right amount of water and food that they typically would get, but especially more so to maintain their health, because the consequences of not doing that could be potentially, more dire given the pandemic. You want to mitigate risks in terms of really your situational awareness and understanding the particulars of COVID sickness and non-COVID sickness to the degree that you can among the children in your care, not so much among your employees for ADA reasons, as I had mentioned earlier on in the webinar, but for the kids in your care. Go back, review the paperwork you have on file for them, or the digital files you have on file for them. What allergies do they have? Do they have seasonal allergies? Do they have things that either may look like COVID or may mask COVID? So you want to have those considerations at the forefront of your mind so that you can mitigate the risk involved, especially as the season of summer approaches. Face coverings and temperature checks. Obviously, if you're working with infants and babies, they are not going to have face coverings. We do not want them to be without oxygen because they are not mature enough to appreciate or to handle face coverings. But you do want to have those conversations, and sometimes those conversations can be a combination of actual age-appropriate talks about how we take in oxygen and how we need to be mindful of our airways, and also pictures, so imagery, to really get that information stuck in kids' minds about how to safely cover their mouths and their faces, so not only their mouths but their noses, but also how to alert you if they may be having negative repercussions from that. So for instance, if they have an improper fit, do they know that they can communicate to you, perhaps if they have a headache, which would in some cases signal that they're not getting enough oxygen in. So those types of things to mitigate risk. Temperature checks. Going back to the issue of penalties mentioned before, there is no easy way, really, to prevent staff or the children in your care from showing up to your business after having taken Tylenol. There's no easy way to prevent that. It would be very difficult, if not impossible, to prove that happened if somebody had COVID. But I would say don't even put too much stock into that, because the science has shown that there are people who have COVID who do not have temperatures. So you want to have a balancing act of, taking temperatures to see if any fevers exist, but also using the information that a fever is not the end all and be all of COVID, assessing COVID risk, to ensure that people on site are healthy. Safety risks. You want to, if possible, have your employees and yourself wearing what I call atypical clothing or coverings. So shoe coverings. For those who know anybody or who may have, you know, any side business or whatever in real estate, shoe coverings are not new, and they're fantastic, and they ensure that any of the gunk and, you know, grime that we have on the bottoms of our shoes aren't transferred throughout your facility. You can look at shoe coverings and slippers for everybody who comes in at quite a low rate. Spatial awareness issues, again, is what I had mentioned before, just to emphasize that, but not so much in the sense of the public health issues of transmitting, you know, not only COVID, but anything, but also in terms of what furnishings do you have in place? Do an assessment of, you know, are there any things that kids could bump into now that have been moved to make space for physical distancing, that you quite hadn't really taken stock of in terms of any downstream effects of you know, any new furniture adjustments. And then cleaning solutions that are what I put here, child oriented. They're really just human oriented, but the EPA has a wonderful database of products that you can go through. Here I will click on business. I will click on fragrance free because, again, to note is that a lot of facilities, especially schools, but a lot of places that care for children are now leaning more towards fragrance free environments because of allergies, etc. But you can fill this out however you want. I am going to fill it out as all purpose cleaners, but you can come to this site and go through this, you know, various lists, various, combinations of products that meet this criteria, that are fragrance free, that are, you know, for businesses or for home environment, that are all-purpose cleaners, that meet the EPA's rigorous standards in terms of protecting humans, but I am adding emphasis to children, from particularly noxious or harmful chemicals in the task of protecting oneself and one's place of business from COVID. Personnel and operations risks. Again, financial issues, including debt. Now, obviously, you don't ask your employees if they have debt, but you can understand, you know, being around people, if people seem flustered, if people seem anxious, etc. That still doesn't mean you ask them a darn bit about any financial issues, but you just assume that because a lot of people are struggling, some of your employees may be struggling. So again, you mitigate risk of any ways that these stressors could negatively impact their ability to care for the children in your care by providing that readily available information to really facilitate the connection to that information so they can help themselves. Employee health issues. Something that was mentioned, and admittedly, I am going to have to send out in the email that you will get an answer to this from legal counsel. The question, what are requirements to wear face coverings for those whose medical conditions may preclude such usage, such as asthma? So if you have employees who have severe asthma and or allergies, and wearing a facial covering, a face covering, is a threat to their immediate health, how do you reconcile that with the fact that they need to be covered because they are working in close proximity to children? So that is a question to think of, and which I will have the answer from an attorney for you in the upcoming email. And again, do you need insurance riders?
Yasmin, this is Dion. I have a question.
Yeah, go right ahead.
Would you recommend that child care providers implement contact tracing in their employee screening? So for example, you know, you have a form that employees fill out each morning when they show up for work, and that would include what their activities were the evening before. I know it sounds like privacy intrusion, but I am thinking about that because I have a neighbor who's a nurse, and over the weekend she threw a 20-some-odd people party. No one was social distancing or wearing a mask. And I just wondered to myself, did she disclose the fact that she engaged in such risky behavior over the weekend to her employer? So just a thought. I don't know what you think about that. Maybe, have them complete this form when they arrive at work in the mornings and before they leave work, because you never know, but someone might come into work feeling fine in the morning, but by the end of the day, they don't feel so good. And maybe you want to record that.
So the answer that I will give, which is as comprehensive I can give it, while also providing the disclaimer that I am not an attorney, and I would not dare use my mother, who's an attorney, her legal skills. Generally speaking, you want to, as a child care provider, with specific regard to contract tracing, follow what the guidance from your jurisdiction is. So if that's the state of New York, if it's the state of New Jersey, if it's the state of California, follow what they are doing in terms of taking the lead. Only, I shouldn't say only because, but primarily because unless you have an attorney on staff or you have the ability to get quick legal answers, you don't want to put yourself in a compromising position of having violated ADA and having violated HIPAA in terms of medical information. And the lines between privacy, especially when it pertains to public health in a pandemic, are in fact muddied in some ways. But I would say that may be a possibility to do that type of contract tracing, but not before you actually reach out to your particular licensing authority or your state, and get that information in writing as to what is best practice. Because that question has come up many times, and attorneys right now are still figuring out the specifics, because a lot of it is not just static information. It's based on the particular circumstances of the day or of the week in terms of what's going on. So the best way I can break that down is, are you in a phase 1 versus phase 2 in terms of, is it reasonable to do that? Is it even legal to do that? So my best answer is, before anybody would do that, even though I understand it and it makes perfect sense to me, still, is it legal to do that? So that's something that can be answered, or asked of your local legal aid society. In the Rochester area, there's Volunteer Legal Services project. So there are attorneys to ask that question, because really that comes down to an issue of legality.
Thanks, Yasmin.
No problem. And I have just like a couple slides left. I know we started a couple minutes late, and I'm going to end a couple minutes late. Hopefully that's okay. If you need to leave, that's fine. In terms of bolstering preventative measures, I'm just going to highlight at this point a couple of things that are highlighted in the guidelines. So speaking to your point, the more a person interacts with different people and the longer and closer the interaction, the higher risk of COVID-19 spread. So bouncing off of that question, you may find that in the immediate time, you don't want to really get into people's personal affairs and their activities outside of the business, because in other cases outside of COVID, you wouldn't know and you wouldn't think to ask. And obviously COVID is a unique situation, but what you can do is you can, again, make it known to those that you're providing care to, their families and employees, that the more interactions you have with people, the higher risk. And so while we can't tell you what to do, these are the expectations that we have for people who engage with our business. We hope you align with these practices. And these are ways to make doing these things easier, which may not sound satisfying, but in terms of what has been put out by legal authorities, as well as experts, that's the best you can do right now without wading into a can of worms, opening a can of worms. Each community is unique. Appropriate mitigation strategies should be based on the best available data. Decision-making will vary based on the level of community transmission and local circumstances. So you are not, I'm trying to think of the poem, you know, man is no island, you know, unto himself or whatnot, which is to say, you are not alone in this. If you have a question about what is going on in the community in which you are located, you have resources. You can call, again, the public health department. You can call the Department of State. If you are in New York, you can call the Department of State in Albany. You can call a number of agencies as well as private organizations to see what data they have, to see what information they have that will help you. Because as you know, sensical or as common sense as these guidelines are, again, you need to find a way to make them make sense for your particular situation. So the characteristics, and of course, I'm just reading the highlighted part, of the community, health system and public health capacity. So again, in addition to wanting to know what's going on with your business internally, have a mind or an eye for what's going on externally. Are you aware of what the current public health capacity is? So if somebody were to ask you, are the hospitals overrun or are they doing fine? You should know the answer to that, because that will give you a signal as to whether you should be shoring up your mitigation strategies with regard to these public health guidelines that have been discussed, or whether, you know, there's been a change in situation and to some degree they can be scaled back, which is really what this exercise, at least in New York State, has been, going from, you know, phase 1 to 2 and then ultimately 3 likely or possibly in just, I think, a couple of days. Community mitigation strategies should be layered upon one another. So you should have several layers of safeguards, which really has been a common theme throughout this webinar in terms of getting the bare bones, the skeleton or the guidelines, pairing that with information from different sources. So not only internal information, but information from medical experts, etc. Now, this I spoke about before, the soiling of the clothes, but it's an important one because bodily fluids and being mindful of them, including drool from babies who are absolutely adorable, is still something that you want to prevent as much as you are reasonably able to do so. And before ending, I did want to just give the high-level answers from Dr. Elizer, which I will be writing up and pairing with the supplemental information that she has provided me, so that you have it not only verbally from me, but also in writing to refer to at a later time if desired. So one of the questions was, what symptoms other than fever and cough should we be aware of in preschool-aged children? So Dr. Elizer said, specifically, fever for 5 days or more. So fever that's not just high, but fever that doesn't abate. Weird rash, okay? That's a clinical term, but weird, and she broke this down for me. For those either who have children or who work with children, which is you all in this case, you know on perhaps an intuitive level what passes muster as normal from just life experience and what you've seen, right? So a rash developed from a mosquito bite that's been scratched looks different from a rash that may be from, you know, diaper chafing, etc. So a rash, but one in particular that if it catches your eye as being weird to you, again, to use that non-clinical term, then go with your gut and reach out to a medical professional or to the parent in this case to let them know if you notice something. As always, and these are her words, decrease intake of fluids in a food by mouth and lack of urine, so signs of dehydration, lack of appetite. Also, how the child is behaving. So are they normally acting or are they acting different? And the difference that she zeroed in on is, as she explained it to me, a difference that's unique to when you have seen this child or a child in general present as being sick. how do you keep children safe when social distancing is not feasible? It seems like it's going to be really difficult to keep kids under 5 socially distanced. That was the question. The answer, as she reiterated, good hand hygiene, which she, and I'm sure other people have said, other doctors, but she has said there is nothing that beats, well, not nothing, but she said that good hand hygiene is of paramount importance in terms of decreasing transmission. Ensuring that everyone maintains good hygiene. So it's not, and this was regarding other people, so it's not enough that kids' hands are being kids in your care's hands are being washed adequately and frequently. You cannot slack off, essentially, because the kids are washing their hands. You have to do it as much as they do. Schools being transparent to report illnesses. So here, if a child is sick, report it, you know, to the parent, right? And just give the parent all of the information possible as to what you have noticed in terms of any development of symptoms during the course of the day. Somebody asked, in the big picture, how likely is it really that there is child-to-child transmission of COVID? And that was a popular question. And this may not be a satisfying answer, but it is an answer nonetheless from somebody who works in the field, who is a pediatrician at Children's Hospital at Montefiore. She says, it's a microbe. Children are best at passing microbes around. So in the big picture, that would suggest that, you know, microbes get spread around. As she said, they are the best at it. So again, revert back to the guidance on cleanliness, on washing hands. And remember also, and this is just something from the CDC, soap and water more so than an over-reliance on hand sanitizers. And those were the questions that were presented. If there are any additional questions, you are welcome to submit them and she will answer them, also with additional reading up on material to be provided. The next webinar is next Wednesday, same time, same location. And we will be going over the nuts and bolts of marketing in a COVID-19 world, in terms of really drawing out how you differentiate yourself in a positive manner to not only keep current clients, keep current families, but also bring in additional revenue. And I am just checking to see if there are any questions in the chat box, and I do not believe there are. If anybody has any questions, you are free to ask, or you could send us an email.
Great. Thank you so much, Yasmin. This has been hugely informative, and I hope that everyone who joined us on the call today found the information helpful. As Yasmin said, our next workshop in the series, workshop 3, will be next Wednesday at 11:30. And thank you for attending. Enjoy the rest of your week. See you next Wednesday.